Hello and welcome to the Module 9 video of the NACC-PSW certification exam. We'll be going through some practice questions with detailed explanations of some of the questions that can guide you to write the exam. Question 1. Which of the following is a common physical sign that a person is nearing death? A. Increased appetite. B. Rapid shallow breathing. C. Fever and chills. D. Hyperactivity. Option A is incorrect because when a person is near death, their appetite typically decreases significantly. This is because the body is conserving energy for essential functions and the digestive system slows down. So even at this stage, you can't force feed the person because the person will feel discomfort. In option B, rapid shallow breathing or Cheyne-Stokes is a common breathing pattern in the final stages of life, and it is characterized by periods of apnea and shallow rapid breathing. In option C, while fever and chills can occur during illness, they are not consistent or defining signs of nearing death. They might indicate an underlying infection or other condition, but they are not specifically related to the natural dying process. Hyperactivity is not a common sign of nearing death. In fact, dying individuals are more likely to experience fatigue, drowsiness, or decreased responsiveness as their body slows down. So, with respect to the options we have, our answer is option B, rapid shallow breathing. It is a natural part of the body's process as it begins to shut down. Other signs that can occur include decreased appetite, cool or mottled skin, and weakened pulse. Question 2. What is an appropriate intervention for managing pain in a dying client? A. Administer prescribed pain medications as directed. B. Distract the client to ignore their pain. C. Suggest physical activity to relieve discomfort. D. Withhold medication to avoid addiction. Pain management is a critical aspect of end-of-life care. Administering prescribed medications as directed will ensure that the client is comfortable and free from unnecessary suffering. In palliative care, the primary goal is to enhance the quality of life, and effective pain control is essential to achieve this. For the other options, while distracting techniques like listening to music or talking may provide temporary relief or comfort, it is not a substitute for effective pain management. Ignoring pain can lead to unnecessary suffering and reduce the client's quality of life. Physical activity may not be appropriate for a dying client because they are often weak and fatigued. So, encouraging unnecessary movements would cause additional distress or exacerbate pain rather than relieving it. Concerns about addiction are not relevant in end-of-life care. The focus should be on the client's comfort and well-being and not on long-term consequences of medical use. So, we'll be going with option A. The appropriate intervention for managing pain in dying clients is to administer the prescribed pain medications as directed. Question 3. Who pronounces the person dead from the options below? A. Social worker. B. Doctor or nurse. C. Respiratory therapist. D. PSW. Social workers provide emotional, social, and logistical support to clients and their families. They are not trained or authorized to assess or pronounce death. In most healthcare settings, the legal authority to pronounce a person dead rests with a doctor or, in some jurisdictions, a registered nurse. This is because they are trained to confirm deaths by assessing vital signs including heartbeat, breathing, and pupil response, as well as documenting the time and circumstances of death. Respiratory therapists specialize in managing breathing-related issues and operating equipment like ventilators. While they play a critical role in patient's care, they are not authorized to pronounce death. PSWs assist with daily living activities and provide emotional support, but they are not qualified to authorize or make medical decisions or pronounce death. They are, however, often present and may notify healthcare professionals if they observe signs of death. So, with respect to the options below, our answer is option B, a doctor or a nurse. Question 4. What is the best approach when assisting a family dealing with grief during the client's end-of-life care? A. Provide privacy but remain available to answer questions. B. Avoid involving the family in care to prevent stress. C. Discourage them from showing emotions around the client. D. Focus only on the client and not on the family's needs. Families often experience intense emotions during a loved one's end-of-life care, so providing them with privacy allows them to process their feelings and spend meaningful time with their loved one. Being available to answer their questions demonstrates empathy and support, helping them to feel reassured and informed during a challenging time. In option B, involving the family in care when appropriate is actually a source of comfort and closure for them. Excluding them may increase feelings of helplessness or regret. Option C, expressing emotions is a natural and healthy part of grief, so discouraging emotional expression can suppress their ability to process loss and hinder their emotional well-being. The clients themselves may also find comfort in seeing their family express love and care. In option D, end-of-life care is holistic and involves supporting both the client and their family, so ignoring the family's emotional and informational needs can leave them feeling unsupported during a critical moment. So the best approach when assisting a family dealing with grief during the client's end-of-life care is option A, providing privacy but remaining available to answer questions. Question 5. What is the primary reason for placing an unconscious patient in the sideline position when mouth care is provided? A. To reduce plaque buildup in the mouth. B. To make the oral cavity easily accessible. C. To prevent positive musculoskeletal injury. D. To reduce the risk of aspiration. While regular mouth care is important for reducing plaque buildup, the position of the patient is intended for aspiration prevention and not for plaque control. The sideline position does provide some accessibility to the mouth, but it is primarily chosen for safety reasons. The main purpose is to ensure that fluids do not enter the lungs, which is a higher priority during unconscious care. Option C is incorrect because musculoskeletal injury is not the main concern when placing an unconscious patient in the sideline position for mouth care. The primary reason is to prevent aspiration, which can lead to serious health complications. So, we'll be going with option D. When providing mouth care to an unconscious patient, placing them in a sideline position will help to prevent fluids like saliva, water, or toothpaste from entering the lungs. Aspiration can lead to severe complications like aspiration pneumonia, so the sideline position will ensure that the fluids drain out of the mouth rather than being inhaled into the airways. Question 6. Hospice palliative care is characterized by care that A. Takes place in a hospital setting for a long period of time. B. Promotes quality of life. C. Provides relief from suffering and cures the disease. D. Shortens the suffering of the family by providing a quick death for the patient. In option A, hospice care can take place in various settings, including the patient's home, hospice facilities, or nursing homes. The goal is to provide comfort and not to hospitalize or prolong life unnecessarily. Hospice palliative care focuses on providing relief from the symptoms, pain, and stress of a serious illness, rather than aiming to cure the disease. It aims to improve the quality of life for both the patient and their family, with an emphasis on comfort and dignity in the final stages of life. In option C, hospice care focuses on relieving suffering and not curing the disease, so that answer is incorrect. Option D is also incorrect because hospice care does not aim to hasten death. Instead, it focuses on providing comfort and support for the patients and their family during the final stages of life. So the correct option out of all we have is option B. Hospice palliative care is characterized by care that promotes quality of life. Question 7. As a PSW who may have to assist with post-mortem care, you should do all of the following except A. Brush hair if necessary. B. Place a disposable bed protector under the buttocks. C. Gather the resident's belongings. D. Discard hearing aids and or glasses. As a PSW assisting with post-mortem care, it is important to treat the deceased with respect and dignity. You should not be discarding the resident's belongings, such as hearing aids, glasses, or any other personal items. Instead, these items should be collected carefully and returned to the family or the appropriate authorities for safekeeping. If we look at the options, in option A, brushing the hair if necessary is respectful to tidy the deceased appearance. In option B, this is done to maintain cleanliness and prevent any soiling of the bed, and this is part of the post-mortem care. In option C, personal belongings should be collected and returned to the family or stored properly. So, what we shouldn't be doing as a PSW is option D, discarding hearing aids and or glasses. These items should be collected and returned to the family or to the appropriate authorities for safekeeping. Question 8. What should you do if a dying client refuses food or water? A. Insist that they eat or drink for their strength. B. Respect their decision and inform the healthcare team. C. Administer food or water through a feeding tube without consent. D. Call their family to convince them to eat. The answer here is option B, respecting their decision and informing the healthcare team. Their refusal to eat food or drink water may be a natural part of the dying process as the body begins to shut down and it no longer requires nutrition or hydration. So what you should do is respect the client's decision and provide comfort measures instead. And then you inform the healthcare team so that they can assess the situation and provide any necessary supports for the client. What you shouldn't be doing is insisting that they eat or drink for their strength. This is inappropriate as it disregards the client's autonomy and their decision to refuse nourishment. You should also not be administering food or water through a feeding tube without their consent. This is a violation of the client's rights and ethical standards. Also, while the family should be informed, trying to convince the client to eat goes against respecting their wishes. So the best thing to do is to respect their decision and inform the healthcare team. Question 9. Why is self-awareness important? A. Personal beliefs may impact the care you provide. B. You need to tell people what to do based on your experience. C. Being culturally sensitive requires being aware of your own stereotypes. D. Both A and C. Self-awareness is important in healthcare and caregiving for reasons like being aware of your own beliefs, biases, and value. And this is crucial because it can influence how you interact with the client and make care decisions. So understanding your own perspective helps to ensure that you provide objective, compassionate, and non-judgmental care. Cultural sensitivity also involves recognizing and respecting the cultural background and values of others. So self-awareness will help you to identify and challenge any unconscious biases or stereotypes you may hold. and this is essential for providing respectful and effective care to people from diverse backgrounds. So we'll be going with option D, which is both A and C. Personal beliefs may impact the care you provide, and being culturally sensitive requires being aware of your own stereotypes. Question 10. As death approaches, it appears that the last sense to be lost is A. Hearing, B. Vision, C. Smell, D. Touch. As death approaches, research and observations suggest that hearing is often the last sense to be lost. Even if a person is unconscious or appears unresponsive, they may still be able to hear. This is why it is recommended to speak to the dying person even if they seem unresponsive, as they may still be aware of what is happening around them. For options B, C, and D, vision tends to decline earlier, and the person may lose the ability to see or have blurred vision as death nears. The sense of smell may also decrease earlier in the dying process. And while touch may be diminished, it typically isn't the last sense to go. It is often affected before hearing. So the last sense that is lost as death approaches is option A. And this is based on research and observations. Question 11. As a PSW, how should you support the emotional needs of a dying client? A. Ignore their emotions to focus on physical care. B. Encourage them to talk about their feelings if they wish. C. Share personal opinions about death and dying. D. Avoid discussing the topic of death. For option A, ignoring emotional needs can make the client feel unsupported or neglected. Both emotional and physical care are equally important. In option B, encouraging them to talk about their feeling if they want to, while providing a listening ear and emotional support is very important as a PSW. You have to be present and validate their emotions, and this reduces the feelings of isolation and fear that they may feel. While empathy is crucial, sharing personal opinions can shift the focus away from the client's needs, and it could make them feel uncomfortable. It is better to be a supportive listener than to project your personal views. Avoiding the topic may leave the client feeling unheard and misunderstood. So if the client wishes to talk about death, it is important to engage in that conversation with sensitivity and respect. So as a PSW, you can support the emotional needs of a dying client by encouraging them to talk about their feelings if they wish. That is option B. Question 12. What is the primary goal of hospice care? A. Providing intensive medical interventions. B. Offering support to both the client and their family. C. Prolonging life through aggressive treatments. D. Isolating the client for better monitoring. Hospice care does not focus on intensive medical treatment. Instead, it emphasizes symptom management and comfort rather than aggressive medical interventions. The primary goal of hospice care is to provide comfort and support for individuals who are nearing the end of their life, and this care focuses on improving their quality of life by managing symptoms like pain and offering emotional, spiritual, and psychological support to both the patient and their family. In option C, hospice care is not aimed at prolonging life, rather it focuses on comfort and quality of life in the final stages. And in option D, hospice care seeks to provide care in a supportive, compassionate environment, and this is often in the client's home or at a hospice facility. They are not isolated, but rather they are surrounded by loved ones and caregivers. So the primary goal of hospice care, based on the options we have, is option B, providing support to both the client and their family. Question 13. Non-verbal indicators that a person is experiencing pain include A. Resisting care. B. Change in usual behavior. C. Decreased functioning. D. All of the above. Nonverbal indicators that a person is experiencing pain may include a variety of physical and behavioral changes, and these can include resisting care, change in usual behavior, and decreased functioning. A person in pain may resist care because they associate it with discomfort or because moving or being touched exacerbates their pain. Pain can also lead to changes in a person's typical behavior, such as becoming more withdrawn, irritable, or agitated. Individuals in pain may also have difficulty performing tasks that they normally would do, such as walking, eating, or dressing, due to the discomfort or limited mobility that they feel. So, non-verbal indicators that a person is experiencing pain includes all of the above. They can resist care, there can be changes in their usual behavior, and they can have decreased functioning. Question 14. Which is not a principle of providing care for a dying person? A. Maintaining the client's dignity. B. Controlling symptoms like pain and discomfort. C. Limiting the client's social interactions. D. Respecting the client's wishes and preferences. A principle of providing care for a dying person involves supporting their emotional, social, and psychological needs, and this can include encouraging meaningful social interactions. Limiting social interactions may be inappropriate unless the client specifically requests this or if it is necessary for their comfort or well-being. So out of the options we have, the option that is not a principle of providing care for a dying person is option C, limiting the client's social interaction. Question 15. Upholding and promoting the Residents' Bill of Rights for residents of long-term facilities is the responsibility of A. Only doctors, nurses, and administrators. B. Only the Director of Nursing. C. All workers and professionals in the long-term care institution. D. The activity departments of long-term care institutions. For this, we'll be going with option C. The Residents' Bill of Rights ensures that residents are treated with dignity, respect, and fairness, and all staff members have a role in supporting these rights through their daily interactions and care. Upholding and promoting the Residents' Bill of Rights is the responsibility of everyone working in a long-term care facility. So it's not just for a specific staff member. It includes all doctors, nurses, and administrators, as well as personal support workers, activity staff, housekeeping, and dietary staff. Question 16. How can you support a dying client spiritually? A. Force your own beliefs on them. B. Respect their spiritual practices and provide access to spiritual resources. C. Avoid discussing spirituality as it is a personal matter. D. Dismiss their spiritual concerns as irrelevant. Supporting a dying client spiritually means respecting their individual beliefs and offering them the opportunity to engage with spiritual practices that brings them comfort. This might include facilitating access to religious or spiritual leaders, providing sacred texts, or allowing time for prayer or reflection according to the client's wishes. So what you should not be doing is forcing your own beliefs on them, avoiding the discussion of spirituality since it is a personal matter, or dismissing their spiritual concerns as irrelevant. How you can support them is by respecting their spiritual practices and providing access to spiritual resources. Question 17. When a client has difficulty breathing, what should the PSW do? A. Open the window or turn on a fan, remain calm, reposition, loosen tight clothing. B. Encourage the person to walk outside. C. Close the window, remain calm, reposition, loosen tight clothing. D. Turn on a fan and distract the person by telling stories and talking. For this, we'll be going with option A. When a client has difficulty breathing, it is essential to help alleviate their discomfort while ensuring their safety. So what you can do, turn on the fan or open a window. Fresh air or a fan can help improve ventilation, and this may provide some relief to the person that is having trouble breathing. It is important to also remain calm to help reassure the client and avoid adding to their anxiety, which can make breathing more difficult. Also, helping the client into a more comfortable position, such as sitting upright or propped up with pillows, can make it easier for them to breathe. Then, loosen all tight clothing, especially around the chest and neck area, which can restrict breathing. So, this is what the PSW should do. Open the window or turn on a fan, remain calm, reposition, and loosen tight clothing. Question 18. Which of the following is a sign of imminent death? A. Increased energy and alertness. B. Cool, mottled skin and weak pulse. C. Rapid heartbeat and elevated blood pressure. D. Excessive sweating and fever. Option A is incorrect because increased energy and alertness is not associated with imminent death. Instead, as the body nears death, the energy levels typically drops and the person may become unresponsive. As death approaches, cool mottled skin, which can appear as blotchy or pale, and a weak pulse are common signs of the body shutting down. These signs occurs because circulation slows down and the body begins to prioritize vital functions. The skin may feel cold to the touch, especially in the extremities, and the pulse may become weak or irregular. In option C, while a rapid heartbeat and elevated blood pressure can occur in the early stages of illness, it is not typical of imminent death. As death approaches, the heart rate often becomes irregular and weaker, and the blood pressure drops. Excessive sweating and fever are symptoms that may be present in some medical conditions or infections, but they are not signs of imminent death. So out of the options, the signs of imminent death is option B, cool mottled skin and weak pulse. Question 19. Immediately following the death, what should the PSW do? A. Perform the PSW's personal ritual to support the family. B. Clean the room of all of the deceased personal belongings. C. Position the body in a natural flat-lying position with the head on the pillow and the sheets neatly arranged. D. Never leave the family alone with the deceased. Immediately following the death of a resident, the PSW's role is to ensure that the body is properly positioned and treated with respect. This involves positioning the body in a natural flat-lying position, ensuring that the head is on the pillow and that the sheets are neatly arranged to maintain dignity and comfort. Also, it helps to make the body presentable for family or staff that may need to handle it or make arrangements. So, our answer is option C. That is what the PSW should do immediately following the death of a patient or resident. Question 20. What is the best way to communicate with a dying client who is nonverbal? A. Assume they cannot understand and stop communication. B. Use nonverbal cues like holding their hand or making eye contact. C. Speak loudly to ensure they hear you. D. Focus only on physical tasks and avoid unnecessary interactions. In option A, it is important not to assume a person cannot understand just because they cannot speak. Many nonverbal individuals can still hear and comprehend what is being said, so stopping communication may cause the person to feel isolated or abandoned. When a client is nonverbal, it is important to continue communication in a compassionate and respectful way. So you can use non-verbal communication like holding their hand, making eye contact, or using a calm, reassuring tone of voice. This will help to convey presence, support, and warmth. So even if the clients cannot respond verbally, they may still understand and feel comforted by your communication. In option C, while speaking clearly is important, speaking loudly may be overwhelming or distressing. So it is better to speak calmly and at a normal volume, which would be effective. Option C is incorrect because even if the person is nonverbal, emotional and social needs are still important. So avoiding interactions can contribute to their feelings of neglect or loneliness. So the best way to communicate with a dying client who is nonverbal is option B, using nonverbal cues like holding their hand or making eye contact. This brings us to the end of the video. Thank you for watching. Don't forget to like, comment, and share. And also hit the subscribe button so that you'll be informed when our next video will be dropping for the NACC certification. Thank you for watching, and I'll see you in the next one.